Hello, everybody, and welcome to the Outbreak Management Advisory Board. Whether you're watching live, watching afterwards, or you're a member of the committee, welcome and obviously appreciate all of your time in joining us today. We've got quite a full agenda, and I know some approximate timings have gone around, so I'll do my very best to keep us to time, as I know we've got a number of important updates to hear, given everything that is happening at the moment. I don't have any apologies to record, so the first agenda item is declarations of interest, just to give committee members an opportunity to declare anything that they want to. I can't see anybody indicating, so no additional declarations of interest to declare. That then takes us on to agenda item 2, which is the minutes of the meeting held on the 9th of December, and also the actions arising that are recorded with the minutes. So I'd like the board's permission to sign off the minutes as a correct record, and obviously just to tell you that all the actions in the action log have been completed. I could see some nods, so what I would say is if you don't agree with that, now's your time to indicate or shout, and I'll hear you. If not, we'll take that as agreeing the minutes. So thank you very much. Which then swiftly takes us on to agenda item 3, and Fiona's going to update us on the current situation in York, and I'll hand straight over to Fiona.
Thank you. So I've got some slides, and also there was a one-pager that has gone out with the agenda pack, so you've all got that to refer to. But if we can have the slideshow shared. So what I wanted to do was, first of all, update you in terms of our current rate of cases in York as it stands today. So today, our 7-day rate stands at 637.6, and that includes cases up to the 7th of January, and that is now higher than the regional and England rates. And that is a very different picture to where we were at our last board meeting, when we had the lowest rates in the region and were in tier 2. So I wanted to focus today really on some of the more recent data and what has happened since our last meeting. So this first slide that we're on at the moment, the black bars just give you a closer look at the data over December and up to the 5th of January. And these are the number of positive tests by day. So you can see that cases were reasonably steady, and then in the week between the date there of the 15th and the 22nd of December, we saw a doubling in the daily number of cases, going from 50 to 100 cases per day. And then in the week after that, up to the 29th of December, we saw a second leap of more than double, from 100 to 225 cases per day. Looking at this data, we might have reached the peak seen here on the 4th of January, but as yet it's too early to say. So we are obviously continuing to monitor the data very carefully. So just kind of trying to think a little bit about what was happening at that time. So the first week of doubling related to what was happening around probably the 18th to the 15th of December. So if you remember at that time, as I said, we were a tier 2 area. It was the last week of the school term, lead up to Christmas, with potentially social gatherings permitted as they were in tier 2 and pre-Christmas activities. And then that second leap that we saw in cases was what happened really right up until Christmas. So schools had finished, but potentially social gatherings and maybe people travelling out to other areas as well. So if we just go on to look at the next slide. So this shows us what the kind of age bands in terms of infection we're looking at. So what we can see is that over the period where we saw those increases on the right of this graph, our 0 to 14 age groups, which is the orange line, that's generally where we've seen the lowest number of cases occurring. But there was an increase in this age group at this time, and we saw the rates equaling that in other age categories. It has now dropped down to having the lowest rate again, but that was something that was a bit different to what we'd seen previously. But it is fair to say increases were seen across all the age groups, but probably less marked in the sort of 65 plus age group, who are the group probably less likely to be working and possibly more cautious and more likely to be more stringent on following public health measures. The age group with the highest rates of infections has been the 35 to 49 age group. Just then going on to the next slide. So the other thing that has happened at this time has been the spread of the new variant of COVID. So this data here is based on estimates from typing that has been carried out on a sample of tests. And this shows how the variant could have spread at this time. So it's a bit difficult to see, but the darker purple areas indicate where you've got a higher proportion of cases being the new variant. So you can see York marked there with the red arrow, but you can see that from November to early January, York went from having very few cases of the new variant to potentially having up to 75% of cases being the new variant. And what we know is that this new variant can be transmitted from one person to the other much more easily. So the public health measures that we need to put in place to mitigate against the new variant are exactly the same. But in essence, the new variants, is less forgiving around any lapses to following that advice. So going then on to what we've seen over this period on the next slide in terms of hospital admissions. So admissions to hospital, we can see there over to the right, are still rising. And if we did reach the peak of infections only around the 4th of January, we can probably expect that this rise will still continue. Don't know if you can see that. Move on to the next slides. Yeah, that's it. Yeah, so you can see the peak of admissions still rising there. Just want to go then onto the next slide and just look at the data around deaths. So firstly, looking at the latter part of last year. So we did see a rise in deaths slowly through October and into December. And unfortunately, given that what I've just showed about hospital admissions still rising, we can expect that we will see deaths continuing over the coming weeks. And then just to comment on the whole of the 2020 year, which we now have the data for. So for 2020, there were 218 COVID-related deaths. And when we compare that to our baseline years of 2014 to 2018, for 2020, there was an excess of 142 deaths in our York residents in that year. On there, so don't know if this slide can move on. So the next slide shows us our data from our local contact tracing service. So our local service work in partnership with the National Track and Trace Programme, who make the initial contact with people that have tested positive, and any that they can't reach, they pass on to us. So the black line is those that are passed to us that we can action, and the red line, which is virtually the same, is those that we have actioned. There are a few instances where we can't action the cases, usually because either the time frame has passed. So we did have a few more of those over the Christmas period. And then the purple line is those that we have been able to successfully contact. And then if we just go on to the final slide. So this graph shows in black the proportion of people that we successfully contacted across the weeks that we've been operating. So in the most recent week, we've contacted 65% of those cases passed to us. So along with the national programme, it means that contact tracing is carried out on almost 90% of positive cases in York. The green bar shows the proportion of people that don't respond to our initial phone call and for whom we have to do a home visit. So these are the proportion over the week since we started. So in the most recent week, we've had to visit 25% of cases, which is obviously much more labour intensive for our team. So one of the things we will be doing is some more comms around encouraging people to engage with the contact tracing service so that we can reach more people and be able to do that over the phone, which is obviously quicker. So that's really the end of the data that I wanted to share with you, and apologies that it hasn't been the most positive update this time.
Thank you very much for that, Fiona. I'm very happy to open it for any questions or comments that anybody would like to make. I'll just give a couple of questions. If not, obviously what we're being asked in that update is obviously to note the presentation, and I'm sure we can pick up any concerns as well on future agenda items. Sian.
Yes, sorry, I don't know if this is a stupid question or not, but do we have an understanding of what led to the rapid increase in cases in our area? Do we sort of understand how the disease spread? So, I mean, I know there was a lot of press attention around people coming into York from outside, but do we have any sort of data that helps us understand what, where transmission was happening, who was getting it? Are there things that will help us understand that, to help us think about if this, God forbid, continues to happen, how we might react to reduce the spread of the disease?
Fiona?
Yeah, so obviously one of the things talked about was a new variant, which was much more transmissible. But what we know is that the virus has mostly transmitted through social contacts. A lot of that is contact that happens indoors in people's homes. Some of that transmission, as I sort of pointed out, the time period that we were in at the time was, maybe activities that people wouldn't normally be doing, getting ready for Christmas, catching up with people socially, and because we were in that position at the time where we were in tier 2 and more of that social interaction was permitted, that people took advantage of being able to do that, but with a much more transmissible version of the virus. As I say, any sort of slight breaches in not maintaining social distance, not hand washing, all of those things that we know work, it just enabled the virus to take advantage of that and to spread really quickly.
Thank you. Danny.
Thank you, Chair. I thank you for the report and the one pager in the agenda. I didn't know where else to bring this up, but it's linked to the rates of infection in the city and what we can do about it. So I wanted to raise schools and a query about the number of pupils still in schools and the way that the approach that's then taken by employers and in the city and of course members on the board can represent a whole range of employers across the city. relating to your HR policies and the council's own HR policies about working from home and sending children to school, because there's this tension for working parents that they want to, if they're allowed to, send their children to school in some cases because of the pressure to get on with some work and the range of options that might be open to employers, such as furloughing, and not being taken up this time round in this lockdown. And I just wonder what's happening in York with that, with school numbers and with the opportunity for the local authority and other employers to take a leadership position in the city and a much more compassionate approach to dealing with working parents who are working at home.
Thank you. I'll go to Fiona first, and then I'll bring Amanda in. And obviously, if anybody else wants to come in on that item, if you wave at me, I'll know it's not a normal question. Fiona.
Yeah, I mean, it might be Amanda will sort of know more around in terms of how many children we've currently got in school and the position that schools are taking. I suppose from a public health point of view, one of the things to say that is that, throughout the last term, autumn term, we had, relatively few cases within schools. We did get schools, but all of the risk assessments that schools had put in place and they're sort of close working with us when they did get cases to do that contact tracing within the school environment and isolate children who needed to isolate worked really well. And we weren't in the position of many other local authorities where they had to close whole schools because they had infection through the schools. But as I say, Amanda will be able to update in terms of what's happening now in schools.
Thanks, Fiona. And I think that's really important to remember that York's done very well throughout the pandemic in terms of rates within schools. And the school system and public health have worked really closely together to make sure that schools are safe places and have done that really well for almost a year now. The guidance has changed this time from lockdown 1, and that's particularly around who is a critical worker, who's a key worker in the first round. And what that means is that some of our schools have had more children in than they had in lockdown 1. It's an issue for some of our smaller primary schools because their physical buildings are quite small and it's quite difficult to have high numbers of children in that space. So we've been working with York Schools and Academies Board, as we've done right through the pandemic, to look at how we can offer places to as many key worker children as possible safely. And in some circumstances, that's been offering them a place in a different school so that we can enable some of those children to be able to access education. We've also met as part of our gold structure to look at what we can do as a local authority in terms of supporting our critical workers to not take up a school place unless they absolutely need to take up that place, and have been very actively doing that, and also actively saying to partner agencies, if you're able to do that, please do, but also to let us know if you're in a situation where you've got critical workers who aren't able to come to work because they can't access school places. I think it's fair to say that the first week back was difficult while we were kind of working out how this was all going to work, but this week things do feel a lot smoother. Again, very important to say the schools have been amazing and the school system's been incredible in terms of managing what is a really difficult situation and an anxious situation for a lot of them, in making sure that vulnerable children particularly are in school, which is of course very important, and that key workers can still get access to school for their children. All of our schools are updating their risk assessments regularly. They're live documents and will not do anything that doesn't comply with their risk assessment. And we're in very close contact with the Department for Education around how it's working for us. I've been in a call with them earlier today.
Thank you very much for that, Danny.
Yeah, thank you, Chair, and thank you, Fiona and Amanda, for those answers. I guess the last part, just to come back on as a supplementary, is around furloughing staff, because I appreciate all you've just said there, and maybe it's one for Ian. I'm not sure, but it's just about are there any more measures that can be seen to be taken by employers, by the council? The council's encouraging staff not to take up those places at schools so we can reduce pupil numbers to those that absolutely need it. But at the same time, it's not really, I don't know if it's considering offering furlough to employers. The offers all seem to be a significant reduction in pay, in my view, in terms of you got to continue working, or you take annual leave, or you take unpaid leave, and that's your problem in essence. And I think it's harmful to health and well-being for those employees. So I guess it's a question and a comment, really. If there is an answer, that'd be great. But if I can just plant that as a concern, then I welcome that. So thank you, Chair.
Thanks, Danny. Ian, did you want to come in on that?
I mean, it's quite a wide range and questions I think Danny's raised, and there are different aspects to it, and clearly Amanda has covered quite a few issues. I think on furlough, I mean, clearly it's for each organisation, each business to make their own determination. They need to apply to the government in that respect to take that view. In terms of ourselves, I mean, the short answer is, I mean, clearly we haven't ourselves sought to furlough our staff. In the main, that is because we've found things for people to do, particularly during the first phase, and then we've adapted further. And so, you know, there's a lot of work to be done, clearly, and, you know, we've sometimes had to move people around to do that, but we've very much taken the view that in responding to the pandemic, there's more than enough for staff to do. In terms of our own arrangements, in terms of that flexibility and that balance between, you know, who's a critical worker, but also who works from home but maybe can look after children. The main thing we've done is to really try and be as flexible as possible, and therefore, you know, we've said to people, well, look, you know, if you want to work a few hours early in the morning, and then log off and, you know, look after your children who are at home, but then maybe come on later in the evening, you can do that. And so we've tried to be as flexible as possible. And I think the whole thing between, you know, key workers, critical workers, you know, new definition, and how we've worked is to try and be as flexible as possible, you know, but we recognize there are some situations which are a little bit difficult to manage. What we've said is for managers to work with all of our staff to try and resolve those issues, you know, in the same way as we've been working with schools to try and resolve those issues.
Thank you very much. What I'll probably do now is take Mark, Julia, and Alison's questions, and then go back to Fiona and Mark.
Thank you, Fiona, and I don't know, Sharon. I guess it's a question for you, and I'm not asking you to have a crystal ball, but I think it would be good to understand where you see this graph going in terms of infection rates going forward, and particularly where will potentially the new baseline be? So, you know, with the new very infectious variant, are we going to get back down to the same numbers anytime soon that we've seen after the first wave and over the summer and immediately up to kind of the beginning of December, or will that by definition be higher even when we do, you know, when we do everything we should be doing and compliance is high and so on? So it's just really understanding. Probably, I don't want to talk about exit, but at least kind of maybe the next few months and give people a bit of information where that might develop into. Thank you.
Thank you, Julia.
Thanks. I just wanted to follow up on Sean's question about the rapid increase. And I suppose, you know, the new variant is around in other parts of Yorkshire and the Humber, and York is has had a much higher increase in other parts of the region. And I suppose, so I mean, obviously, Fiona, you're the expert, not me, but I'm not sure it's just about you know, the virus taking advantage perhaps of an opportunity, but we did have, and we know from police activity, a lot of people coming into the city, and I suppose it's just making sure that as we come out of this, we've looked at all of the data and we've really understood the reasons for that increase, so that we can make any arguments that we might need to make around how we potentially prevent that again.
Thank you. And Alison.
I just wanted to clarify the rules around furlough, that if you're employed and funded through the public purse, you can't be furloughed. So most of you here can't furlough any staff anyway. So I'll just clarify that.
I shouldn't say to Councillor Myers, I did ask about furloughing councillors, but that is not allowed as well. Fiona, there's quite a lot in the questions there. I'll go to you first, and obviously Sharon, if you want to come in at any point, just indicate. Fiona.
Yeah, so on Mark's question, yeah, it'd be good to have a crystal ball and know what was going to happen. It is a difficult one. I suppose we can look at what we've learned so far through the pandemic. So we do know that lockdown measures work. So when we were in lockdown before, we did start to see cases, you know, come down quite dramatically. So we do expect that we'll see cases drop. It's not going to happen just yet because obviously, you know, we've got a bit of a time lag. So if we went into lockdown on the 5th of January, it could be sort of 10 to 14 days before you start to see that impact occurring in the data. So we will hopefully see that. But then what we've also seen is as soon as you lift lockdown, you see cases start to go up. So, you know, that is something that we'll need to prepare for as well. So, and obviously going into lockdown now, we're potentially at a higher starting point than we have been previously. So whether we get back down to those really low levels, you know, we'll learn more about this new variant, what that brings. But then the positives are, you know, this is a respiratory virus. So by nature, they are more prevalent in the winter. So as we move nearer to spring, we should naturally expect to see that there is some reduction in spread as well. And though we're going to talk about it later, but as the vaccine starts to roll out more widely, across the city as well, we will start to see the impact of that. So it's very difficult to predict, and it's just something we're going to, you know, kind of have to monitor. Just coming to Julia's point, yes, you know, you're right that, you know, the new variant has been in other parts of the Yorkshire and Humber region, but I suppose it's coming back to that point about, you know, we had that new variant, but you know, as we were in an area where more social gathering was permitted, so there was more opportunity, as it were, perhaps for that virus to spread. I think the difficult thing when trying to pinpoint exactly why something happened is that there is never one reason. So there's always like a combination of factors that play into it. So yeah, it does make it sort of really difficult to pinpoint, you know, if you would do any one thing differently. It's a combination of lots of things.
Sharon.
Yes, just to support what Fiona has been saying there. So we know that the new strain of the virus is more prevalent at the moment in York and North Yorkshire, which are the two areas that we're in tier 2 in this period where we've seen numbers go up. The rest of Yorkshire, and so West Yorkshire, South Yorkshire, were in tier 3. So they were under stricter restrictions anyway, and that will certainly have helped to limit the spread of the virus there. So I think that's an important point. I'd also like to pick up Julia's point on the people coming into the city. We have had discussions around this within the council and also with our partners in the Local Resilience Forum. And so we are at the moment pulling together the data that we have, showing the mobility data of how people have travelled across York compared to the first and second lockdowns. And we're also working with partners to gather intelligence around where people visiting York were from. So we are currently compiling all of that information. We will then be sharing that information with the LGA, the Local Government Association, and we'll also be sharing it with the LRF as well, which we hope will help inform discussions at government about any future tiering. And some of the challenges really when you have neighbouring areas in different tiers and we're allowing movement of people, the impact that has on the spread of the virus. So that's quite an important piece of work we're doing at the moment as well.
Thank you very much for those responses, which is appreciated. So in a sense, we're noting the report and those questions that we've been able to ask. And then I'll move us on to agenda item 4, which is an update on the vaccination programme. And I'm handing over to Steph to go through this update.
Good evening, everyone. Since my last update on the 9th of December when we met, members of the committee will be aware through the national media that the Oxford AstraZeneca vaccine's been licensed. So clinicians are supporting the vaccine rollout using both the AstraZeneca Oxford vaccine and the Pfizer vaccine. So the vaccine programme's working well in North Yorkshire and York, and we continue to deliver the vaccine to the initial cohorts identified by the Joint Committee for Vaccinations and Immunisations. Just to remind people, these are residents in care homes for older adults and their carers, all those over 80 years of age and frontline health and social care workers. And we're planning, in addition, for all those over 75 years of age and over, all those 70 years and over, and extremely vulnerable individuals, clinically extremely vulnerable individuals. So the programme's being delivered from 12 local hubs in North Yorkshire and York, with a broad geographical spread, and also there's 3 hospital hubs in Harrogate, York and Scarborough. And I mention this reach because particularly for workers, they could be vaccinated outside of their residence. So York currently have 2 local sites approved, Haxby Health Centre and a site at Askham Bar. And these cover all our residents. So if you recall in December, I said early approval of sites were restricted in terms of numbers per city. So Haxby and Askham Bar were vaccinating before Christmas using the Pfizer vaccine. But we also now have the hospital hub at York District Hospital vaccinating, and all 3 sites are using both vaccines that are available to us. And additional sites are now also under consideration. So sites are receiving supplies of both Pfizer and Oxford AstraZeneca, and the national ambition is that those 4 priority cohorts will be vaccinated by mid-February. Now, some of those dates move around a little, and we get targets frequently and often, and the targets become tighter and tighter. But the limiting factor is always going to be the availability of the vaccine to us. So at the moment, I have no localised activity data, but nationally, you'll perhaps be aware from the national media or Twitter or anything other than the CCG, that between the 8th and the 8th of December and the 3rd of January, we vaccinated just over a million people in those early cohorts. And we hope to be able to have something a bit more localised from the national data collection by NHS region, and our region is North East and Yorkshire. I want to finish on a couple of really positive points. Firstly, our staff who've been out vaccinating. We've had an abundance of people who are ready to fill rotas at very short notice when we know about the vaccine supply, and they are really energised by doing the vaccination programme. And that's secondly because the people receiving the vaccine are just incredibly positive. And so the combination of our staff getting this sort of boost and the really positive engagement of our residents and patients who are being vaccinated are just making some of the more difficult aspects of the vaccination programme around, we talk about bumpy supply of vaccine, but all of the frustrations about trying to roll out what is a technically difficult programme across the whole of the country. Actually, our staff and our residents are reporting a really positive experience, and given the sort of information that Fiona and Sharon shared, you know, we will work through the cohorts as quickly as we are able to do. Yeah, I just wanted to sort of finish my piece on saying what a positive experience staff and those receiving the vaccines are having.
Thank you very much for that, and nice to have a positive note at the end, and particularly at the moment. Sharon.
Yes, just a comment really, so that the board is aware. The government have made a commitment to sharing local vaccination data with local authorities and directors of public health, so that we're then able to work in partnership with our NHS colleagues to identify where there are pockets of people or groups of people in the community who haven't yet responded to the invitation for vaccination. So I haven't been given a date by which this data will be available to local authorities, but we've been given that assurance, which I very much welcome. We need that data as city partners to be able to support the NHS with their vaccination efforts. So hopefully by the time we meet again as this board, we will have some local data to share with you.
Thank you. Julia.
Yeah, very, very quickly, Chair, because I'm conscious of time. I just wanted to say that everybody I've spoken to who's been involved in the vaccination programme, whether it be doctors or people, members of the public, have had nothing but positive experience, and that is really good to see. It's a real boost, I think, for people at this moment in time. So I just wanted to say thank you, really. It's just great to have a bit of light at the end of the tunnel.
Thank you very much for that. I can see lots of people nodding. Sian.
Yeah, I just wanted to raise a bit of a communications issue in that we have picked up from other agencies a concern that people wouldn't be able to book a vaccination if they couldn't go online. And we've had a lot of clarification from local systems about that isn't what's happening. People will get picked up if they can't book online. A number of agencies have agreed they will try and help people who haven't got access to being online. So I know people who've been in contact through the GP non-medical helpline. We've been trying to look at ways to help them with this. But I think there was a communication issue that people thought if they couldn't book it online, they'd get missed. So I think it's really important that we're clear with people that they're not going to be missed because they can't book online. So I just wanted to make that absolutely clear. We know people will be picked up. If you can't book online, don't panic. You will get picked up. I think that's just something we were picking up from other agencies, and I wanted to just really be clear about that. No one will be left out.
Thank you for that. Steph, did you want to add anything?
Yeah, no, that's really helpful. Thank you. Our experience, although we talk about vaccination centres, you know, they are our clinicians who are used to engaging with our citizens and with our patients. So you're absolutely right. I'll make sure that we're also reinforcing those messages. Thank you.
Thank you very much for that. So we're noting that report, and we can move on to agenda item 5, which is an update on lateral flow testing, and back to Fiona.
Thank you. And again, I've just got some slides just to share some of the detail with you on this. Quite a lot's happened since our last meeting of this board. So on the first slide, if you remember that at our last meeting on the 9th of December, we agreed that we would commence lateral flow testing for people that live or work in York, and our first priority would be those working in the hospitality, retail and transport sectors, and then our second priority would be those working or living with a vulnerable person. So to update, we started testing at the York St John site on the 14th of December to our first priority group, and we extended that offer to the second group by the end of that week. So we know that we had a lot of people who took up that offer for themselves. We know that some people came on the advice of their employer, and we also know that some people took up that offer because they wanted to be able to see family over the Christmas period. Then on to the next slide. So a few other notable things happened in the time period. So just at the end of school term, it was announced that secondary school pupils should be tested prior to returning to school in January, and that a programme of contact testing should be rolled out in secondary schools. So this is whereby if there's a positive case in the school, any contacts would consent to be tested on a daily basis in order that they could be able to continue coming into school. So by working with our secondary schools across York, we agreed to a citywide approach to testing children prior to return. So you might remember at the time there were various news stories of schools in other areas who, after a very difficult autumn term, being told that they had to have a facility up and running to test children by the start of school term, and them just really wondering how on earth they were going to do this. So by working together with the schools across York, we put in place a plan to do this. We planned to start on the 4th of January, but parents were very keen to have this and booked anyway for their children. So we actually started testing children on the 3rd of January. And then obviously then came the announcement on the 4th of January that schools would not reopen to all children. So what we've done is we very quickly adapted that offer to change it to still be able to offer testing for the children of any key worker or vulnerable children who would be returning to school. So there was a citywide offer for them to be tested. And then what we have been doing since is we've supported the secondary schools to get up and running with testing their staff, and also to be able to have the process in place to be able to do the contact testing if they do have any positive cases within the children who are in school at the moment. And then what we've also been looking at is how we roll out that staff testing to primary school staff as well. And then on to the next slide, just in terms of our resident offer. So obviously then we had the announcement around national lockdown. So what we were able to very quickly do was to amend our offer to be for anyone basically that cannot follow the work from home guidance due to the nature of their work, and to be able to access that. And that offer was in place from the 5th of January when we went into lockdown. And that does include people who are working in a voluntary role, or people that have to leave their home to support a vulnerable person. We also opened an additional testing site at the University of York last Friday, and we are progressing looking at other sites as well. So just to give you a bit of a flavour in terms of numbers, so on the next slide, at our York St John's site, since the 14th of December, we've done 4,855 tests, and since last Friday at the University of York, we've done 476 tests on residents in those groups. We've also tested 527 secondary school pupils. Of those tests that we've carried out, 144 of those tests have been positive. So if you think about the R, if we have an R value estimated as high as 1.4 at the moment, that's potentially another just over 200 people that those people might have gone on to infect, and then those could have gone on to infect more people too. So we can see that this testing is making a difference. So on the last slide, just looking at our next steps. So we will continue this offer for residents, and we'll be looking at another site so that we can offer greater capacity and also accessibility across the city for residents. The part of this that I haven't mentioned is around university testing. So the universities were also required to test their students before they return to study, having done a mammoth task of that before students returned home for Christmas. So face-to-face learning's not happening for the majority of students, but there are some courses who are back, and so working in partnership with both of the universities will be jointly running those sites with our offer for residents and secondary school pupils to ensure that those students who are returning to study can receive tests as well. And I guess that's a good point to end on as well, just to say that if it wasn't for the University of York and York St John University working with us to deliver these sites, it wouldn't have happened. And also all of the head teachers across the secondary schools in York and our colleagues in the council within their education department as well. It was some quite ridiculous timescales that we were working to, really, but actually by all of those partners working together, we were able to pull it off and have a good offer for residents and students across York. Thank you.
Thank you very much for that, Fiona. And I'll open it to any questions or comments and go to Lisa first.
Thank you very much, Chair. And just seeking a point of clarity, really, I think it's been a great service that's been offered to the residents of York. So really good to hear that update and the uptake of numbers. Just a query in terms of people thinking about using the service. So if they've been in contact with somebody who's positive and they're attending thinking, I'm going to go and have one of these tests because I might be negative. That doesn't negate their requirement to isolate as per the regulations, even if they get a negative test. So they have to continue to isolate. And I think just that clarity for residents.
Yeah, they're absolutely right. So because of the incubation period, so if you've been a contact, you know, if you have a lateral flow test, it may come back negative, but you could still be in that period where you might develop symptoms. So yes, you still need to follow that isolation period for the 10 days as per national guidance.
Thank you, Sharon.
Thank you, Chair. Fiona, part of our outbreak management plan is offering targeted testing in those communities where we've seen high numbers of cases. So do you want to say something about the targeted testing that we've been doing in Bishopthorpe and Woodthorpe, etc.?
Yeah, so I've just talked about the lateral flow testing that we've put in place, but yes, also across this period of time where we did see the rise in cases, we responded. So as Sharon says, we had an outbreak potentially linked to the schools in the Bishopthorpe area, which then we saw rising cases within that community over the Christmas period. So we had additional testing, not using lateral flow tests, but using the PCR tests via a mobile unit which operated in that area for a period of a week at the start of January. And there were, I think it was about 1,500 people who took up the offer to have a test, and we've subsequently seen, you know, the rates in that area dropping off quite significantly now. We had a similar situation within the village of Askham Richard at the same time, given that it's a smaller location and the difficulty of finding a site. What we did was to offer those residents to be able to access, under the direction of the Director of Public Health, to be able to access the Poppleton Bar drive-in site so that they could have symptom-free PCR testing at that site. Things moved very quickly, and after dealing with those situations, the area of Woodthorpe and Acomb Park and into the Dringhouses and Foxwood area, we've seen the rate of cases rising quite dramatically in that area. So again, we have put a mobile testing unit into that area on Thanet Road, which is again PCR testing. That's been there for a week. I think it started last Wednesday. It was initially due to be there for a week, but we're going to extend that because those rates are still going up in that area, and we want more people to take up that offer to have that testing at that site. So yes, we've tried to be reactive to where we've seen those cases and put in additional resource for those communities.
Thank you very much for that. So we're noting that update and those questions, and then that takes us on to agenda item 6, which is looking at the impact of the lockdown. And Lisa's going to give us an update from North Yorkshire Police today, and then just to flag that James Farrer will then give us an update next meeting in February in terms of businesses and the economy. So thank you to James and Lisa, and straight over to Lisa for today.
Thank you very much. So I'll start with just a general overview from a policing service perspective. So we've had good attendance rates across the service, with our staff and officers predominantly remaining well during this period, which has been great. And so we are still delivering a full policing service across the City of York, despite some of the challenges faced from this pandemic. We have had a number of cases of officers and staff testing positive for COVID, and the requisite isolation has taken place for all of those team members that have been in contact with those staff, but we've managed to cover all of those abstractions with other staff again. And I know I echo what others have said about the fantastic work of other emergency service and blue light and health staff of really stepping up and stepping into those gaps to make sure that we continue to deliver that service. So a big thank you to all of those and the partnership efforts to continue to deliver that service. So in terms of how it actually has felt out there since the last meeting that we had on the 9th of December, as has already been mentioned, during that period, we've gone through tier 2 to tier 3 to lockdown, and that has made the city feel very different from a policing perspective as we have gone through those phases. And I will share with you some of the statistics in terms of enforcement in respect of those changes in the regulations. So some of the broader challenges for policing really are about people understanding the difference between legislation and guidance. And actually, the holistic position is to protect each other and our families and our communities from the spread of the virus. So whether something is either legislation or guidance, really is the same advice is going out there about not spreading the virus, whereas we found quite a challenge with members of the public wanting to very much distinguish between what is law and what is guidance, to create some of those freedoms that we understand that people really crave in a situation like this, but has caused obviously quite a challenge in the spread of the virus, as we've seen from some of the health statistics. So one of the biggest challenges during tier 2 was the number of visitors to the city. And we were surrounded by predominantly tier 3 areas. It is not, or was not, and still isn't, against the law to travel. So the actual act of travelling is not against the law. It's not an offence. It's not within the COVID regulations. And what becomes an offence is what you then do when you arrive at the place that is either higher or lower than the tier where you live and you have travelled from. And this again caused quite a challenge from a policing perspective of people just understanding the nuances, because it did become quite a tongue twister and quite complicated. Of if you travel from a tier 3 into a tier 2, you have to abide by the tier 3 regulations from where you have travelled from, but in certain circumstances you can undertake tier 2 activities as long as it's not against the law to undertake those activities in the tier 2 area. And then the adverse comes into play if you travel from a tier 2 into a tier 3, that you of course have to abide by your tier 2 regulations, but you also have to abide by the tier 3 legislation in the area into which you have travelled. So as you can see, there's some really quite complicated nuances here that we understandably found the public struggling to understand. However, during that period, and we've seen from some of the health figures, and we've had conversations here this evening about maybe some of the root causes of the increase in the virus. So the statistics from the 2nd of December through to the 5th of January, we issued 154 fixed penalty notices in York, of which 115 of those were to visitors and 39 were to local people. Predominantly, these were for breaches of the regulations on indoor gatherings of visitors from tier 3 area coming to a tier 2 to use our licensed premises to have a meal and have a drink in large groups, in breach of the legislation of having an indoor gathering beyond your household or bubble in terms of what is the qualifying party of people that you are allowed to be with. And of course, when those licensed premises closed, we did also see people mixing indoors in private properties because they couldn't mix anywhere else indoors and the weather wasn't fantastic. Again, breaching the regulations in terms of the numbers of people gathering or gathering at all outside of that household or bubble inside a private dwelling. So they were some of the challenges that we faced in the city. And of course, you will have seen for yourselves during that period of tier 2 that the city very much felt like normal Christmas shopping was taking place, and pictures of Coney Street and crowded areas where people had quite rightly, understandably, come to enjoy the tier 2 regulations when they had travelled in from an area where the restrictions were tighter. So that was a real challenge for us. And as you can see from the figures, we did take a fairly positive stance in terms of the enforcement in that respect. Differently to that, now during lockdown, the statistics from the 6th to the 12th of January during lockdown have seen us issue 22 fixed penalty notices within the city. 19 of those were local and only 3 were visitors. Again, predominantly indoor gatherings against the legislation. So, and that of course is in private dwellings because there are no premises open for people to gather in. So 15 breaches of indoor gatherings against the legislation, and 7 breaches for those outside in the open air, but nevertheless in gatherings of groups of people that were outside of the regulations. We do still operate under the 4 E's, as we call it in policing. So I'll just remind people of what they are and then pause to take any questions. So we adopt and engage, explain, encourage in the first instance. So because of some of the difficulties of people understanding the nuances of the regulations, we do engage with people. We explain to them what the regulations and guidance say. We encourage them to follow those aspects of the guidance and legislation if they've just misunderstood where they are supposed to be or allowed to be, and encourage them to go home and stay at home and protect the health service. If all else fails or they refuse to accept our advice, we do move to enforcement, and as you'll have heard from some of the national media, we are now moving more quickly to enforcement because during a lockdown the rules are fairly clear to people. That they shouldn't be outside of their home unless it's for an essential reason that is stated in the regulations, and therefore we are seeing ourselves issuing more tickets, and we are fairly high on the league table, if you want to call it that, nationally, given we're big geography here, but small in number in terms of the size of the police force and the service that we deliver in comparison to some of our larger areas, metropolitan areas and populations that surround us. We are near the top of the league table for the number of fixed penalty tickets that we have issued as a force. So we are taking the enforcement element of that very seriously to try and encourage people to follow that advice. So I will pause at that point and more than happy to take any questions.
Thank you very much for that. And open that for any questions or comments. One from me first, if I may, is obviously been a lot of media coverage with regards to issues in shops and in particular supermarkets and the need to clamp down on the advice to wear masks, which I see now a number of supermarkets are doing and using their security staff to do that. Just any view from you or any support that you could give to shops and retail workers to try and make sure we're all nice to each other as they push that forward?
Absolutely. And the first thing I would say is that every single person in this walk of life, every human being deserves to be treated with respect out there in our communities, and that includes people trying to keep people safe. As you'll have seen, the assaults on emergency service workers have increased very concerningly during this period, predominantly out of frustration by people being challenged. So I do empathise with those security staff and people working in those environments being concerned for their own safety in challenging people about the regulations. So the support I would offer, it is absolutely still in the regulations in terms of face coverings on public transport and to enter a supermarket. And I know there's been some communication out there about whether the police will or won't attend. The vast majority of the public that we deal with, if they are engaged with at the door of a supermarket or trying to get onto a bus or a train, if they are asked to put a face covering on, they will in most occasions politely do so or leave the area. And if there is any volatility or difficulty in encouraging somebody to do so that refuses to act reasonably and the police are called, we will attend to support you as somebody that is trying to deal with a challenging individual when you've tried to enforce that legislation of them entering a shop or entering transport. And of course, we would encourage those security staff to have that polite conversation first, because we can't physically cover every door of every supermarket and every bus stop. It's just not physically possible. But I do empathise that people are concerned, but the vast majority of public will comply when engaged with at the doors of these supermarkets. But they will absolutely have our support if they are challenged with any sort of violence or resistance that puts them in any sort of danger. So we are there to support, but of course we need this to be a partnership approach with those people in those positions to encourage the public.
Thank you. Alison.
Yeah, and just to add to that point, actually, I hope supermarkets are being sensitive to people who don't wear masks for genuine medical reasons, that it's not a blanket. If you're not wearing one, you can't come in. But that wasn't my question. My question's about travelling locally. There's been lots of national debate about it, and I wondered, what's our interpretation of local here? Do we have one, Lisa?
Okay, so obviously we had to advise our staff and officers going out there, what does local mean? And we have had, as a national Chiefs Council, direct conversations with ministers about our concerns about travel not being legislated for, and our concerns about local not being defined or legislated for. So all those concerns have been raised at the highest level. But unfortunately, that's the legislation is the legislation and guidance is guidance. So the guidance says, if you go onto the government website, that local at the moment, and it could have changed as we are speaking, but as I understand it on the government website, local is defined as within your village, town or area of the city where you live. So the expectation is, and the advice that we have given to our staff and officers is, yes, there is an understanding that if you don't live somewhere where it's suitable for you to step outside of your front door and go for some exercise in an open space, that you will want to travel a short distance to exercise within that open space. But the expectation we are providing to our officers and staff is to question why somebody has not stepped outside their front door in order to undertake that activity. So local for shopping is obviously you've got to go to the supermarket to wherever that local shop is. The difficulty seems to be with the exercise and the local element of exercise. So our expectation is you will step outside your front door in order to undertake the walk, the run, the cycle ride, etc., unless there is a really good reason for you to have travelled beyond that local town, village area of your city to do so, because it's not really viable or possible for you to take that exercise immediately outside of your own front door. This is about health and safety and spread of the virus. So we're trying to ensure that this advice is not about police trying to enforce some sort of legislation that's not reasonable. It's about protecting people from the spread of the virus, and that is absolutely the reason and aim for us having those conversations with people. So it's guidance only. They're the sort of ground rules we're trying to operate by locally.
Thank you for that. I know there's been quite a lot of confusion obviously on that. Equally, it's a shame that we haven't adopted, say, the position in Scotland, which, although it follows that guidance, it then goes on to say, and the absolute limit is 5 miles of your local authority. Now, whether that's right or wrong, but at least it gives an absolute defined limit. But I'm sure you'll keep raising that, Lisa, and we will have opportunities to try and make that more helpful for people. Mark.
Yeah, I just wanted to comment on the public transport situation, and I'm sure it will kind of reflect Lisa's comments. But we have and we continue to get very, very little feedback from frontline staff regarding any issues, and the compliance is and remains very, very high. Our own COVID wardens on buses that we have across the city report that where they have conversations, as Lisa says, in literally 99% of cases, it is a very simple, oh, I forgot, and put the mask on and get on the bus. I think what would be worth considering going forward, as the so often talked about fatigue sets in with lockdown measures and so on, is more the kind of the reasons for travel, and that's where we probably see a marked difference this time around versus the first lockdown. Still, if I can share that, compared to some other areas in the UK where I see data from, York remains the most compliant area that I'm aware of in that respect. But I do think it is worth maybe just in terms of looking forward, in terms of comms, but also maybe in terms of checks and enforcement, it's not so much the mask compliance, it's why are people out in the first place, and using public transport or any other areas, any other modes of transport, really.
Thank you. Lisa, anything you want to conclude?
No, just a huge thank you really for the fantastic partnership effort, because we do recognise as a policing service, we have a job to do in terms of still protecting people and keeping them safe from crime and disorder. And so the partnership effort in terms of this, through some of that close working with your teams in the city across all organisations that are here, is very, very welcome.
Thank you very much for that. I'm sure it's reciprocated back to the police as well. And equally, Mark, Claire's up next in terms of communications, and I'm sure we'll pick up that point as well. So our next agenda item is agenda item 7, communications and engagement. Claire.
Thank you. I've got a presentation to share. So Robert, I think you're sharing that. Thank you. Marvellous. Right. So once again, I'll start and remind you all of the key messages. So if we can go on to the next slide. I do it every, I'm sure we'll get there. There we go. I'll always remind you of the 4 key messages because we are consistently sharing those through all of our different channels and indeed sharing with you through all of your partner channels. If we go on to the next slide, just to remind you again, there are 3 phases of the management of communications. If we can go to the next slide, please. There we go. So we've got 3 phases, and actually in this last month we've pretty much used all of those phases. So we've been phase 1, where you prevent and provide updates. Phase 2, where if there's an alert following a spike in cases or a change in restrictions, then we amplify communications, and indeed we put that into play on the 30th of December when we moved from tier 2 to tier 3. And then, of course, where we are now, managing an outbreak, which is where we've moved from tier 3 into the national lockdown, which took place on the 5th of January. And there was talk before lockdown came to be that we might have moved into tier 4. So we also prepared our communications for tier 4, although that didn't actually materialise in the end. If we can go to the next slide. If we can move on, please. There we go. So communications roadmap. So that's just to show you all the different activity that I'm building to show you each month that we meet. Right now we're in lockdown, so that means we've increased our frequency of direct communications. Oh, can we just pop back? Direct communications, which include household booklet, which I'll come on to, and we've increased our frequency of Facebook Lives. We've also introduced We've also introduced 3 more campaigns. So we're looking at more testing communications, what we can do to support vaccinations, and something that I'll come on to, which is our complacency campaign. So that tackles COVID fatigue. Is it possible to go to the next slide, please? Don't ask. Can we move on to the next slide, please?
We were warned actually at the start that aspects had been a little bit glitchy
right.
with presentations on virtual meetings today, so it probably is something to do with that.
Okay, I'll just keep talking to the slide I see then, and then I know the slides are published on the website, so if I miss any, we can get back from there. So over the course of the month, we've continued to share accurate and up-to-date information. So we've issued 24 different press releases that are related to COVID, and you can see the subjects and the titles of them there. Everything from, would you believe, deploying the flood defences in a COVID secure way, to thanking residents for the thousands that booked symptom-free tests and everything in between. We've also continued to share our daily case data, which is featured on Yorkshire Radio and then shared across the city, as well as promoted our e-newsletters, which provides up-to-date information as soon as we get it. And we wanted to share and really remind residents about the newsletter system because, of course, things happened so quickly over the last month that it was difficult to stay up. If we go on to the next slide. So on the next slide, I wanted to show you two examples of where that went wrong and apologise to the board. So we issued a social media post that talked about the 5 days over Christmas when, of course, we were only having the 1 day of Christmas. So apologise to the board and to residents who recognised that, and obviously it added to their confusion. We quickly took it down and did a review within the team as to what went wrong, but it did cause confusion, so apologies. Another example of where we had to quickly address inaccuracies is the very quick flip from schools being open on the Monday to being closed on the Tuesday, apart from key worker and critical worker children. So, of course, we had inaccurate information out then that we had to address and pull back. If we can go on to the next slide. We continue to build confidence in the steps that people need to take through our regular rhythm of communication, and there's some examples of things there. That's to just give you an idea of the number of recipients. It's worth noting as well that the member and partner updates that get issued twice a week in normal times and then 3 times a week more recently through lockdown go to 126 recipients, many of which are on the call today and which are part of this board. And we know that they get shared onwards, that they're well received, and that people actually use the information that we provide, and there's examples of that information being used by partners later on. The resident e-newsletter has just short of 1,500 recipients, which doesn't sound much, but we've also seen our e-newsletter shared across Facebook groups and people taking snippets out and sharing across their own networks. So people are using the information and it goes further than maybe the actual recipient list. And then over the course of the month, between the 9th of December and the 7th of January, we shared over 130 different COVID-related social media posts, which include the government stay safe, stay at home messaging that we get as a government pack and share with partners. But also New Year's Eve, we worked hard with partners, including the Minster, to make sure that New Year's Eve was a calm and reflective occasion rather than necessarily ringing the bells and celebrating the new year. If we'd like to go to the next slide, please. It seems a long time ago now, but we also prepared for Christmas visitors. So we anticipated we'd get lots of people in. Obviously, hindsight's a wonderful thing. We had no idea about the variant at this stage, but we anticipated lots of people coming into Christmas because, of course, York is famous for its Christmas spirit and its Christmas kind of look and feel. And we put out more out of doors, out of home signage on banners, bollards, bridges. We also went heavy on social media posts during that time and shared social media across our partners and our networks, produced posters, and then those posters also became postcards that our COVID marshals gave to people who were maybe not following social distancing as much as they could. We also created an animation thanking people for doing all they can to keep the city safe over Christmas, and used that animation as a digital display on a bike that travelled around the city to make sure we got to areas where there are lots of people. If we can go to the next slide, please. Whilst it's getting here, I'll talk you through it. We continued with our Facebook Lives. We had one last night. Thank you to members of the panel. That went really well, where we talked about last night financial inclusion. We held one earlier on just as a point, that lockdown was about to go into place, I think the 4th or the 5th of January. Again, that one was well received. We had 6th of January, there we go, had over 1001 engagements, so different people commenting and sharing, and 77 questions live during the actual event itself. We also held, and we've started to hold, media briefs every time we change restrictions, which are going well, which mean we update the media on the restrictions that are coming into play and the cases and what the cases case data is telling us. We also are boosting social media at the moment to encourage people to complete the Our Big Conversation temperature check, which is when we ask the city and residents to tell us how they feel about the measures that are in place, whether it's helping them feel confident about engaging in the city and shopping local or going into town or going to work or whatever, or whether actually they at the moment feel that the measures are not sufficient, which of course, given that we're in lockdown, it'd be interesting to see what feedback comes back. If we go to the next slide, please. This just tells you what we did during the very short period of time when we were in tier 3. We've almost got a package that you can take off the shelf now of communications for changing tiers. We send out a resident newsletter, we do a load of social, we provide a partner brief, we share all the government communications that they provide us with, and we make sure we signpost help and support, as you can see there. So thank you very much for that one. If we can just go on to the next slide. Where we are now is managing the outbreak. And then the next slide, please. Here we go. So again, just an off-the-shelf response to what happens immediately we go into lockdown. So this all happened on the 5th of January, ready, 4th of January, ready to start. You can see the press carried the information. Of course, we updated the website, provided more information through our e-newsletters, issued statements, updated partners, usual activity, distributed posters, and shared COVID help details. If we can go on to the next slide, we'll get on to some more specific information that have happened during the course of the month, since lockdown started, which was only 10 days, well, just less than 10 days ago. So since then, we've reassured residents about frontline services and changes that we're doing to frontline services to make sure they continue. We've provided and signposted support for different groups of people, whether parents homeschooling, there's a education support pack that we've distributed or we've shared that our educational psychologists have written. We've also shared emotional help for pupils, particularly at the moment for parents through schools. We've signposted the business grants. We're just in the process of producing a whole load of posters that we can get out to refresh the ward notice boards and give to local businesses. And we've continued to provide social media posts around what people can and can't do. Next slide, please. Because we're in lockdown, we are now back into our direct communications planning, which means we will be printing a open letter to residents in the press and online on the press tomorrow, yes, on Thursday. We've already promoted that across social media and on our website. We're sending a letter to everyone who's on the shielded list and a letter to everyone who isn't on the shielded list. And in closing with that, a A5 health and wellbeing booklet, which really is about signposting support, supporting people's emotional well-being, and supporting financial inclusion. And we are starting to plan for, would you believe, our 31st of January anniversary, where we will have, we in York will have been responding to COVID for a whole year, which seems incredible, but there we go. And we're working very closely with the university at that to shape our story so that we can make sure that we know the media will be talking about York and York's role in COVID. And we want to make sure that it's clear that we've worked so well together in partnership. We've done so much for the city together and we've learned a lot as we go. So things have changed since those very first early days last January. But we continue to work together and to do everything we can to support the city. If we can go to the next slide, please. Just an example of steps we've taken to support people with testing. So this is secondary school information we've shared. We continue to promote the tests to across the city, and we provide direct communications to those community groups where we are going into community testing areas, which Fiona spoke about earlier. And to make sure that we fact check inaccuracies, we're actually now responding directly to the community Facebook groups for the communities where we are testing, where there are spikes, to make sure that we can address inaccuracies as we go, to sort of fact check some of them misunderstandings. And then if we can go to the next slide. Next slide is about emotional health. So we've shared more information about emotional health. We've produced an emotional health pack for businesses that we distributed early January, and there's examples of 2 of our partners sharing that information. So just to show that partners are indeed sharing the information that we share with them, which is fantastic. The emotional health pack really is about identifying support for people at this particular time, and we know that people's emotional health is suffering, and we know that people are worried, and you can pick up that sentiment through some of the comments that we're getting through Facebook Live. And then finally, if we just go to the final slide, the work that we've got underway at the moment is the complacency campaign. So that tackles COVID fatigue, and it's we're working very closely with the hospital. Thank you to Lucy. To share patient stories and medic stories around the impact of COVID on a very personal level. We're also working with the clubs to share information through the clubs directly to the 35 to 40-year-old males, because we understand from national insight, not necessarily local but national, that not every that age group is less compliant than maybe some other age groups. And also one of the things that's not on this presentation, which just shows how quickly things change, is we're working closely with the NYLRF on promoting stay local and what stay local means, because that is an area of great confusion. So we're working with partners to see if we can provide some clarity around that. So I'll stop there and take any questions, and apologies for the kind of stop-start of the presentation. I hope you got the sort of gist of it all. Thank you.
Thank you very much for that, Claire, and happy to open it to any questions or comments. The one I thought we could mention first was Mark's question in the last one about fatigue, and a little bit like you highlight just how long this has been affecting the city and what we can do about that together with our communications.
Yeah, so thank you for that. We, in the head of comms group, which met today, we had quite a long conversation about COVID fatigue. And what came out was a real focus on, as well as sharing real stories of how it's impacting people now to encourage people to stay at home and do the right thing, we also need to pepper that with some hope. So, of course, we have the vaccinations, but as well as having the vaccinations, we know as a city we can get to be the lowest case data in the region, which puts us in a really safe space. So we want to really encourage and remind everybody that we can do this. We can all do it if we work together and really focus on what's possible, rather than actually kind of be a bit kind of nebulous about the fact that this could go on for a bit longer. Does that help?
Thank you.
Thank you.
Danny.
Thank you, Chair, and thank you, Claire, as well. It's an amazing amount of work that your team does. There's just one point that's been raised with me a few times, and it's the city centre's comms boards that it's got quite prevalent around the whole of the city centre, and it's just outdated information there about meeting outdoors and about opening windows when you meet indoors together. There's quite a lot of them in town, and I know there's less footfall, of course, at the moment, but I just wanted to pick that up.
Yeah, thank you. We've got it on our list to do. It's the bollards. So we've taken the bridges down. Well, not literally, but we've taken the banners off the bridges. But we've still got the bollards out there, so we need to bring them in. You're right. Thank you.
Thank you very much for that, Claire. So if we could know, obviously, as was just said, all the work and activities that have been done, and I know will continue to be done. Thank you very much. And then we can move on to agenda item 8, which is update from the Universities and Higher Education subgroup, and over to Charlie.
Thank you very much, Keith. I'll not say much. It's all set out in the paper. 4th of January's announcement means that universities and colleges are working predominantly online and remotely, with exceptions. Colleges, like schools, are seeing significant demand for on-site tuition for children of critical workers and vulnerable children. And there are significant numbers of university students in York. That's in part around the small number of courses which have been permitted to go ahead with in-person tuition, and that's in medicine, nursing, social work, and teacher training. Something like, and I can't give an exact figure, something like 3,000 students, perhaps more, remained in York over the whole festive period and are still here. And others have since returned, as they're allowed to do under the guidance if they don't have adequate study facilities at home, or if being here is better for their mental health and well-being. Those students will be studying online in York. Universities and colleges have all put a lot of thought and additional support in place so students can progress their education effectively, deal with well-being challenges, but also engage in online settings with friends and course mates in a recreational sense. We're very grateful also for the support that the city is giving in various ways, including making accessible financial support for students who lose employment possibilities because they have to self-isolate. As we've heard earlier from Fiona, universities and colleges have all now got symptom-free COVID testing underway on site. And the York, St John and University of York sites are now also community sites, working in collaboration with the City Council. They're accessible to secondary school students attending school and indeed to the wider public. Just to give you some more numbers, at the University of York site since the 3rd of January, and these are numbers only for university students and staff, we have carried out 4,279 tests by the close of play yesterday, of which 36 were positive, which is lower than the citywide community figures that were quoted by Fiona earlier. I'm absolutely delighted to see the test centres at my university in York St John running collaboratively with the community. We've got the infrastructure there, and it makes absolute sense to share that for general purposes, and all parties, I'm pleased to say, are showing a very strong partnership spirit. Thank you, Keith.
Thank you very much for that. I'm very happy to open it for any questions or comments. As Charlie said, though, I know the paper was supplied in your packs. So if not, thank you for the update and all of the work ongoing, to you, Charlie, and obviously to all of the higher and further education institutions. And then we can go on to agenda item 9, which is items for the next agenda. We've already got the standard agenda items that we have, and also we'll have that item as mentioned on the impact on the economy. If anybody else has any, obviously you could say now or do email us after the meeting, and we'll make sure that they go on the agenda for next time. Agenda item 10 is dates of future meetings. The next meeting is on the 10th of February, and then it's the published schedule that we've got. So just to note those meeting dates. And then agenda item 11 is any other business. I'm not aware of any other business, so I'll just check for a few seconds that I haven't missed or forgotten anything as the opportunity to indicate. I can see some shaking heads. So just to thank everybody for their presentations, questions, attendance, and that ongoing work that we've mentioned throughout the meeting. And if not before, I'll see you on the 10th of February. Thank you. Bye-bye.